My experience with athletes is probably why I ultimately got into being an orthopedic surgeon. Basically, my first exposure to orthopedics was when I was in college, and I played college soccer at Northwestern University. I ended up shadowing and then doing an internship with our team physician at that time. He was obviously an orthopedic surgeon with a sports medicine background, and he had treated, a lot of my teammates with different surgeries and for different injuries. Since then, I've always been drawn towards athletes because I played a lot of sports growing up, and then I ultimately played college soccer, and sports has always been a huge part of my life and, a lot of the things I like to do. And so I'm drawn to patients that are athletically driven, whether it be super high level high school or college athletes, or even just kind of, at the stage of life I'm at, which was like more of the weekend warrior types, or, if you're training for a triathlon, or, you're just playing men's league soccer, or, just kind of, trying to play in your member guest golf tournament. I really like working with athletes and patients that are, not only just trying to improve, a general ailment, but also kind of maximize their performance. Fellowship training was in sports medicine, and so we were in Denver. Kind of the mentors that I worked with were the team doctors for the Denver Broncos and the Colorado Rockies. We were at all of their training camp. We would go to a lot of their practices. We went to all the games, and we would evaluate them, the Monday after the games. So that gave me a good look into and good insight into, treating athletes at the highest of levels, which has left a kind of a lasting impact on my practice today.